Okay. Well, hello again, everybody. This is Dr. Bulow with Revive Upper Cervical, and this week we are talking about CSF. And what is CSF? If you look at the diagram, you'll see it has something to do with the fluid around your brain. And so the answer to this pop quiz is CSF is cerebrospinal fluid. It's the fluid that surrounds your brain and your spine. So cerebro meaning your brain, spino meaning your spine. Cerebrospinal fluid is the fluid that is around the brain. Now let's talk about CSF for just a minute. I think it's some pretty important stuff as we kick off Brain Health Awareness Month at Revive here. This is a really important support system for your brain. If it's not working right, a lot of people develop issues involving the brain. Issues like headaches, migraine headaches, vertigo, Meniere's disease, sometimes as serious as seizure disorders, multiple sclerosis, Alzheimer's, Parkinson's, autism. All of these issues involve the brain when it's not working appropriately. Not to mention the common things like concussion, chronic fatigue, headaches, things along those lines. So here's my challenge. As we get into talking about brain health and we talk about cerebrospinal fluid today, I would encourage you to share this video. I'm going to get into some talking points here, but I want you to share this video just because you never know. You never know who you might be connected with that may have issues with how well their brain is working. Maybe anxiety, maybe depression. There's so many different issues, and sometimes people just don't know about them. You may not know that your neighbor or your friend is suffering, so please feel free to share this video. With that said, I'm going to get right into it. CSF. Really important, pretty amazing stuff. It's a very clear, viscous sort of fluid. It's produced in the center of your brain. These very little capillary beds called the choroid plexus are inside these little balloons called the ventricles of your brain. And it produces the CSF fluid every time your heart beats. It produces a little bit more and a little bit more. And that CSF comes out of the base of your brain, surrounds the brain and spinal cord, and does these 5 critical functions. It provides some buoyancy, meaning it helps your brain float inside of your skull. If your brain doesn't float the way that it should, it sags inside your spinal canal. That's a very nasty condition known as Arnold-Chiari malformation or Chiari type 0. Each equally bad, creates a back pressure in the skull. We'll get to that. But buoyancy is very important, that your brain is floating and it doesn't have that pressure. Protection, pretty obvious, pretty important. This fluid barrier acts as a protective layer between your brain tissue and the actual bony tissue of your skull. That way, when you knock your head left and right and up and down, you don't actually get a concussion when you do these motions because the fluid acts as a shock absorber to the brain. So protection, very important. Next, we have blood flow. Obviously super important. Your brain depends on lots of oxygen and lots of actually glucose and other forms of fuel for the brain. And so it needs that blood flow to get in there. And in order for the blood to get into your skull, the CSF has to regulate that. Or it inversely will regulate the amount of blood volume that gets inside of your skull. So pretty important there. The last 2, chemical balance and waste removal, super important. If you think of the CSF like a big bath of soup for your brain, there are chemicals and electrolytes and communicating hormones and things like that that keep your brain lobes in communication with one another, as well as removing the waste at the end of the day. When you sleep at night, your brain actually shrinks in size, allowing for the CSF to get in there and actually clean out the inner spaces of your brain and dump off all the waste into the veins of the brain and drain the skull. So a lot of stuff. You can see a ton of stuff that the CSF does for you. Now, let me finish by giving you a little unknown fact. What most people do not realize is that where the CSF pulsates in and out of the base of the skull is a potential choke point. The upper neck bones very often can become malaligned, misaligned, corked and twisted out of position, which can reduce the space that the CSF has to pulsate in and out of the base of the skull. Well, what happens if you actually constrict the fluid there? Imagine if you put a cork in the kitchen sink. What happens to the fluid inside of the sink? It raises up. In your skull, there's nowhere for that fluid to go in a lot of cases, and it creates a back pressure of CSF. And if you look at everything the CSF does for you, if you affect in a negative way that system, now the brain doesn't have as much buoyancy. Now it's not as well protected. Now there's not as much blood flow, and the chemical balance and waste removal is not taken care of as well. So it's not a surprise when someone has had a whiplash injury in their history, maybe when they fell off their bike as a kid, fell from a tree, got in a car accident, played soccer and headed soccer balls. It's not a surprise that people that have had that kind of trauma to their neck, very often in their 20s, 30s, 40s, and 50s, start developing headaches, fatigue, balance issues, trouble with memory loss, neck pain. These things are all connected. So let me just say, if you know somebody, or if you are watching this and you're having some of these issues, I would recommend having the neck evaluated. You go to the neurologist to look at the brain, but you go to the upper cervical chiropractor to look at the neck to see, is the fluid going back and forth into the skull the way that it should? Is the brain communicating with your body through this portal the way that it should? And if it's not, how do we gently correct this and permanently correct this? And so we are here for you. If you have any questions, please ask. You can comment in the comment section of this video. You can message us on Facebook. You can call us. We are here for you. If you're within the greater Pittsburgh area, we'd love to see you and give you a complimentary consultation. If you're outside of the greater Pittsburgh area, message us. We'll help find you a doctor who is qualified that can take a look at you. So I hope this has provided some value to you. Thanks for taking the time to spend with us here. And all month long, we're going to be talking about brain health. So we hope to see you again in the next video, and we'll talk to you then. Bye now.